cryopreservation or sperm freezing or sperm banking. Sperm freezing, also known as sperm cryopreservation, is the process of collecting, freezing, and storing one or more sperm samples in liquid nitrogen for later use when healthy sperm may be more difficult to obtain by. Essentially, sperm freezing protects your ability to become a biological parent independent of your age, illness, injury, medical treatment, or life path. The sperm can be thawed and used for procedures like intrauterine insemination and in vitro fertilization in the future. In modern time, sperm freezing, also called sperm banking, is a popular way for couples or singles to maintain their chances of conceiving in the future, especially if one of the male partners has a high-risk testicular problem such as testicular cancer. Who should consider sperm freezing? Sperm freezing is recommended for males who undergo medical procedures or surgery that can affect ejaculation, decide to go for a vasectomy and might change mind about having a child later, choose gender reassignment surgery and preserve their sperm to increase their chances of conceiving a child later, work in hazardous situations or environment or military and want to save sperm in case of accidents or chemical exposure that can affect sperm or fertility, are proceeding to starting chemotherapy or radiotherapy and have the risk of the reduced quality of sperm, is diagnosed with testicular cancer or prostate cancer and might have to have one or both testicles removed, are getting older and want to preserve fertility to have children later in life, go for fertility treatment and want to ensure that a reserve sperm sample is accessible in the event that the male partner is unable to provide a sperm sample or is unavailable on the day of egg retrieval. The frozen semen sample can be utilized for IUI treatment if the male partner is unavailable on days when his female partner ovulates. Extracted sperm are stored in small vials using a particular freezing solution. The vials are placed in liquid nitrogen-filled storage freezers at predetermined temperature. The sperm of each patient is usually divided into several vials and stored in various storage tanks. The remaining sperm samples are secure if one of the freezers fails. When the sperm is ready to be used, it is thawed in the laboratory until it reaches room temperature. After thawing, it's tested to see if there are any motile, active sperm left. Unfortunately, half to two-thirds of sperm may not survive the freeze-thaw cycle in some cases. Those who do survive, however, may have an advantage in terms of fertility. When these sperms are utilized in IVF, studies show that they are more likely to result in a pregnancy. Anyone who is in good health can freeze their sperm. Sperm freezing is also an excellent option for young boys who have been diagnosed with cancer and have reached puberty. Those interested in donating sperm to a commercial sperm bank must be between the ages of 21 and 35, in good health, with normal sperm parameters and no family history of illnesses or diseases. The amount of sperm you should freeze is dependent on your family planning goals, sperm count, and sperm quality when thawed. Typically, each sperm sample provides up to 4 vials of sperm. 1 vial of sperm is equal to 1 attempt at intrauterine insemination. It's recommended that you freeze 6 to 8 vials for each pregnancy you expect to have when using IUI. You don't need to freeze as much sperm if you plan to use your frozen sperm samples for IVF using intracytoplasmic sperm injection, a procedure that involves injecting one sperm into the egg to fertilize it before transferring it into the uterus. because a single vial of sperm often contains hundreds of thousands or millions of sperm. ICSI allows a single vial of sperm to be utilized practically forever. If you anticipate on having a big family in the future, you will probably want to save more samples than someone who only wants one child. It may also be recommended to save extra samples if your sperm count or quality is lower than expected after an analysis, because sperm quality can vary. We encourage making repeated deposits. In an ideal scenario, you would freeze multiple samples and use the best one later. If you go to a fertility clinic or sperm bank, you will probably have to fill out some paperwork first. Then, in a secluded collecting chamber, you will create your sample via manual stimulation to orgasm, masturbation. For some people, the concept of having to make an appointment and submit a sample in a clinical setting is daunting. In these circumstances, at-home sperm analysis and at-home sperm freezing kits offer an alternative. This method involves receiving a kit in the mail that includes a secure storage receptacle for collecting your sample at home. You will combine your sample with a transport medium that will keep it safe during transportation. Then you can arrange for same-day pickup and overnight delivery of your sample. You should have blood tests done before freezing your sperm to check for sexually transmitted illnesses and infections that might affect sperm quality. This is important to control transmission to partners during artificial insemination, and it is essential in many states if you want to use your stored sperm for IVF. A sperm analysis, which will provide you with information on your sperm volume, sperm count, sperm concentration, sperm motility, and sperm morphology, is also recommended. If your sperm quality parameters aren't where you want them to be, you can start making lifestyle adjustments such as diet and exercise that have been demonstrated to increase sperm quality. Your doctor or a fertility professional may have made recommendations for you to follow. Post-thaw analysis is an essential method to determine if the sample must meet standards in order to be viable in the future. It is vital to consider a post-thaw analysis before freezing the complete sample to get a realistic picture of how much and what kind of sperm you will have after thawing, which is useful information for any healthcare provider who might work with the sample in the future. Frozen sperm is kept in liquid nitrogen or nitrogen vapor storage tanks in cryogenic vials. A specialized cryogenic storage facility with security and constant monitoring of liquid nitrogen levels in the storage tanks is the safest place for frozen sperm storage. Options for using frozen sperm: intrauterine insemination. IUI involves injecting thawed and prepared sperm directly into the uterus, avoiding the vaginal canal and cervix. The treatment is performed at the time of ovulation, which is commonly timed with the help of ovulation medication. When utilizing frozen sperm in IUI, pregnancy rates are slightly lower than using fresh sperm samples, 21% versus 16% according to one study. IUI is a promising choice if your total motile sperm count (TMSC) is greater than 8 million. In vitro fertilization (IVF). IVF is a procedure in which eggs are surgically removed from a patient's ovaries and fertilized with sperm in a laboratory. If a patient's motility is sufficient, they will be able to perform IVF without ICSI. According to studies, frozen thawed sperm had the same chances of conceiving as fresh sperm in IVF. IVF with intracytoplasmic sperm injection (ICSI). ICSI is an IVF procedure that involves injecting a single sperm directly into an egg. When sperm motility is low, It's especially beneficial in situations of male factor infertility. When using frozen sperm in IVF with ICSI compared to fresh sperm, multiple studies have demonstrated that pregnancy rates are similar. Frozen sperm safety measures. State-of-the-art cryogenic storage facilities are monitored around the clock with backup emergency power sources and equipment redundancy to limit the risk of an outage or natural disaster. Cryopreservation banks offer multi-site storage as a default for all clients to further limit any risk. As a precaution, your frozen sperm samples will be sent to multiple cryo storage facilities. Privacy and security measures for sperm cryopreservation. Cryo storage facilities are extremely secure. Cryo storage facilities typically have a video surveillance system with motion detectors that is operational 24 hours a day, 7 days a week. Only trained and qualified personnel are allowed access to card-controlled areas. One study studied at the long-term effects of sperm freezing and concluded that for the first 5 years of cryo storage, there was no difference in sperm survival rate. When sperm was utilized in artificial insemination, there was a small decrease in sperm survival after 5 years and an even less impact on birth rates. According to the findings, the length of cryo storage had no significant impact on clinical results. As per the theory, sperm can be stored indefinitely if kept in the right conditions. However, as per the Assisted Reproductive Technology Regulation Act 2021, a semen sample shall be stored for a period of not more than 10 years, and at the end of such period, such gamete or embryo shall be allowed to perish or be donated to a research organization registered under this Act for research purposes with consent of commissioning couple or individual. Cost of freezing sperm in India. The cost varies by facility and is based on the quantity of samples stored and the length of time they are kept. Lifespan of frozen sperm. It is possible to freeze sperm permanently if it is properly kept in liquid nitrogen and is a high-quality sample. The health and integrity of the sperms are kept throughout the treatment thanks to modern cryopreservation technologies. Sperm freezing has shown to be effective for almost 20 years. Posthumous gametes collection and freezing. The collection of gametes posthumously shall be done only if prior consent of the commissioning couple is available to the Assisted Reproductive Technology Bank.